My first rotation was lab. Here I observed a lab tech and learned how to test blood and urine. In lab, they are looking for any abnormalities that are red flags towards a patient's diagnosis or to help get a better understanding and why what's happening. In the lab, I learned how to take a blood cell count with an actual slide of blood and test for any red flags. This rotation demands critical thinking because there are multiple steps that are required to be done carefully and correctly to get a correct test result. This was my least favorite rotation as it was very slow-paced and had no patient interaction. My second rotation was cardiac rehab. At cardiac rehab, I sat behind the desk with the nurses and observed the patient's monitors. Cardiac rehab is like physical therapy, but for someone who has suffered a traumatic heart incident, whether that's a heart attack, heart surgery, or maybe just an abnormality in the heart. Cardiac rehab is a little bit on the harsher side than physical therapy to get the heart working correctly. With that being said, the patients are on a strict schedule of a 6-week program where they attend 3 times a week for an hour each day. This rotation has some patient interaction, but not as much as I would like. This rotation requires productivity to get the patients in and out and to get their hearts working normally again. My third rotation was ATI physical therapy. In this rotation, I had the most patient interaction and was able to become more of myself and adapt a little easier as I understood what patients were going through. This rotation is unique because each patient has their own story to tell. Physical therapy has a variety of different possibilities of why each patient is there. In this rotation, I had a little bit of freedom and was able to go off on my own and connect with the patients. By the end of the rotation, I was able to find a patient that we called my own, and I began to follow her and help guide her in exercises and set things up for her. On my last day, we both cried, as it was the only beginning of a story. This rotation requires extreme flexibility because it is based off the patients and how they are feeling that day on how you treat them. My fourth rotation was in the residence at Rush Copley in Aurora. In this rotation, I followed a med student who was in their residency. Here we visited every floor where the doctor had a patient and they would come up with their own plan of attack and then get it approved by the main doctor before acting upon it. This rotation had the most patient interaction and was my favorite because I got a taste of everything in the hospital. A 21st century skill for this rotation can be communication because the residents are still their own doctor but need to communicate with the head doctor to make sure everything is okay to treat. My fifth rotation was radiology. Radiology was one of my favorite rotations as I was very intrigued by all the different ways to look into someone's body. In radiology, there are 3 different ways to take a picture. An X-ray, which looks at bones, a CT scan, which is a scan that gets anything internal, and an MRI, which is a magnetic scan that can get anything, whether that is bones, ligaments, internal bleeding, etc. This rotation takes a lot of patience and knowledge to know exactly what angles to test at. In this rotation, I saw many different situations from strokes to heart problems to broken bones. In radiology, you're always kept on your toes because you never know what you're going to be taking a picture of next. My 6th rotation was at clinic at Rush Copley in Aurora. Here I followed a resident through their family medicine rotation and observed what it's like to work in the doctor's office. This was similar to residence but had some differences. At the clinic, it runs like a normal doctor's office where patients have a set time to come in. In this rotation, I was able to follow the MAs around because that is more of what I'm interested in. Here I got to take patients' weight, temperature, and even call them back into the rooms. My favorite part of this rotation was getting to do a pregnancy test and a flu test in the lab part of the clinic. The 21st century skills used in this clinic is collaboration because it is a team effort to treat the patient. My last rotation was in the ER. In the ER, I observed what it was like to be at a little bit of a faster pace, which I enjoyed, considering you're always kept on your toes. The responsibilities I took on were observing the ER nurses and getting a feel for what it would be like to be in the ER. In the rotation, I learned that taking initiative is the most crucial 21st century skill because it is a little bit of a faster pace, and those patients are in the emergency room for a reason. Without taking initiative, their condition can worsen within seconds. I chose this internship to have a better understanding in the medical field. My favorite part of this internship was having patient interaction in the rotations of ATI, cardiac rehab clinic, and residence. One of the biggest experiences I got with this was at ATI when I got one of my own patients in a sense, and I really got to work with her and build a really strong connection with her. My least favorite experience was in the lab. The lab is just a little bit too repetitive for my everyday basis where we got the same tests over and over again, and I just really didn't enjoy it. As to if I'm still interested in the medical field, yes. I really enjoy how you're always kept on your toes and how there's always curveballs thrown at you. You really never know what's coming next. I really enjoy just being a part of that. One of the biggest takeaways from this experience was really understanding what it would be like to have my own patients and having a light bulb click that I can do this. I really was meant to be in the medical field. This experience has influenced my after-school high school plans, because now I understand what classes I need to pursue, what experiences I need to pursue, and what else I need to do to make this a perfect fit for me. If I could give future FE students a piece of advice, my biggest piece of advice would be to make this experience what you want out of it. If you're not living in the moment, asking questions, and understanding what's really going on around you, you're not going to meet the goals that you set before field experience even started.